The gluteus maximus is the large fleshy muscle that forms the bulk of the buttock. The origins of gluteus maximus are from the posterior ilium, sacrum, coccyx, and the sacrotuberous ligament. Some deep fibers insert onto the gluteal tuberosity of the femur. However, the majority of the fibers insert onto the iliotibial tract of the fascia lata. The gluteus maximus is the most powerful extensor of the thigh at the hip. It also assists in lateral rotation of the thigh. It is innervated by the inferior gluteal nerve. The origin of gluteus medius is from the posterior ilium, inferior to the iliac crest. The insertion is to the lateral surface of the greater trochanter of the femur. The gluteus medius abducts and medially rotates the thigh. Along with gluteus minimus, it also stabilizes the pelvis laterally. It is innervated by the superior gluteal nerve. Biceps femoris is the lateral member of the muscle group located in the posterior thigh, known as the hamstrings. Biceps femoris has two heads, the long head and the short head. The origin of the long head is by a common tendon with a semitendinosus from the superior and medial surfaces of the ischial tuberosity. The origins of the short head are from the lateral lip of the linea aspera and the lateral supracondylar line of the femur. The fibers run inferiorly and laterally to insert primarily onto the lateral surface of the fibular head, but it also inserts on the adjacent surface of the lateral condyle of the tibia. Both heads of the biceps femoris flex the leg at the knee and laterally rotate the knee. The long head also extends the thigh at the hip. The long head is innervated by the tibial nerve. The short head is innervated by the common fibular nerve. Semimembranosus is the medial member of the muscle group located in the posterior thigh, known as the hamstrings. The origins of semimembranosus are from the superior and lateral surfaces of the ischial tuberosity. The fibers run inferiorly to insert onto the posterior surface of the medial condyle of the tibia. Semimembranosus extends the thigh at the hip and flexes the leg at the knee. It also medially rotates the knee during flexion. Semimembranosus is innervated by the tibial nerve. Semitendinosus lies posterior to semimembranosus and is the most superficial member of the muscle group located in the posterior thigh, known as the hamstrings. The origins of semitendinosus are by a common tendon with the long head of the biceps femoris from the superior and lateral surfaces of the ischial tuberosity. The fibers run inferiorly to insert onto the medial surface of the proximal tibia. Semitendinosus extends the thigh at the hip and flexes the leg at the knee. It also medially rotates the knee during flexion. Semitendinosus is innervated by the tibial nerve. The origins of tibialis anterior are from the lateral condyle of the tibia, the shaft of the lateral tibia, and the interosseous membrane. The insertion is to the medial and plantar surfaces of the medial cuneiform and the base of metatarsal 1. Tibialis anterior dorsiflexes the foot at the ankle and assists in inversion of the foot. It is innervated by the deep fibular nerve.